Astigmatism is the irregular shaping of the cornea that causes light to be focused on two spots on the retina instead of just one. The cornea is more flattened out instead of being nice and round, and this can be caused by genetic inheritance, pressure from the eyelids on the cornea, or an eye injury. In rare cases, it is caused by keratoconus, which thins the cornea and makes it more easily coned. The symptoms of astigmatism are usually just blurred vision, but if it progresses, vision can become distorted and it can cause eye discomfort, which may lead to headaches. Astigmatism can be corrected with a cylindrical lens, which helps focus the light onto one spot in the retina, or it can be fixed by LASIK, which reshapes the inner cornea and makes it more rounded. Cataracts is when the lens, which is normally clear, becomes cloudy. This clouds the vision of the person and makes it difficult to read, drive, or see the expression on someone's face. It can be caused by a genetic disorder or when an injury changes the tissue of the lens. The symptoms are clouded vision, difficulty seeing at night, being more sensitive to glare, and seeing halos around lights. Surgery is the only effective treatment for cataracts, and in the surgery they take out the clouded lens and they move a new artificial lens into where the old one used to be. Color blindness is the difficulty of telling the differences between colors or shades of a color. There are three main types of color blindness: red-green color blindness, so you would have trouble seeing the 8 or the 5 on the left, or blue-yellow color blindness, where you would have trouble seeing the 4-2 on the right. There is complete color blindness, but it is very rare. Color blindness can only be inherited genetically, so it can't happen because of an injury, and you have it your entire life. There is no treatment for color blindness. Conjunctivitis is the inflammation of the conjunctiva of the eye, which is the little mucous membrane that surrounds the front of the eye and the inside of the eyelids. It is caused by a bacteria or an STI like chlamydia or gonorrhea. Irritants like smoke, shampoo, or chlorine can also cause it. Conjunctivitis causes redness of the eyes, crust on the eyelashes, itchy eyes, or blurred vision. It can be treated by antibiotic eye drops or just antibiotics. Glaucoma is caused by very high intraocular pressure and gets worse over time. The pressure from the inside of the eye damages the optic nerve, and the damage is irreparable. Glaucoma causes blurred vision, rainbow circles around bright lights, extreme eye and head pain, vomiting, and ultimately complete blindness. Glaucoma can be treated with eye drops, laser surgery, or traditional surgery, which allows the drainage system to be repaired, reducing pressure in the eyes. These treatments cannot replace the damage that has already been done to the optic nerve because that damage is permanent. Hyperopia is commonly referred to as farsightedness because objects that are farther away are easier to focus on than objects that are closer up. This is caused because light entering the eye focuses behind the retina instead of directly on it, either because the eye is too short, the cornea does not have enough curve to it, or the lens is further back in the eye. The symptoms of farsightedness are fatigue due to squinting at up-close objects, blurry sight with up-close objects, headaches after reading or focusing on something that is close to you. Farsightedness can be treated by a convex lens or by LASIK, which changes how light is reflected from the eye and focuses it in on the retina. Myopia is commonly referred to as nearsightedness because objects that are close up are easier to focus on than objects that are far away. This happens because light comes into focus in front of the retina instead of directly on it, caused by either the eye being too long or a problem in the cornea or lens. Nearsightedness causes blurry sight looking at faraway things, the need to squint to see clearly, or headaches from squinting all day. It is fixed by a concave lens or refractive surgery that flattens the cornea and allows light to focus on the retina.